Thanks for tuning in to Anatomy News Network.
Today we have a report on the thyroid gland in the endocrine system.
The endocrine system plays a role in regulating mood, growth and development, and metabolism. The endocrine system contains the organs such as the kidney, liver, heart, and thyroid. If your endocrine system doesn't function properly, cells won't get the messages they need to function.
The thyroid gland controls metabolic processes in your body. A disease that affects the thyroid gland is the Graves' disease.
Graves' disease is a disorder that causes protrusion of the eyes. It can also lead to hyperthyroidism, which causes the thyroid gland to make excessive hormones.
Right now we have Rebecca Chagoya on the streets. Let's see what people have to say about Graves' disease.
Thank you, Eric. Right now I'm with Steven. So, Steven, what do you know about Graves' disease?
I'm not exactly sure what that is. Is that when you die?
No, Graves' disease is a disorder that leads to hyperthyroidism, which is too much activity in the thyroid gland.
Oh, never heard of it.
What do you know about Graves' disease?
I know it deals with the thyroid gland and having too much going on in the thyroid gland.
You're correct. How do you know about Graves' disease?
I am currently in anatomy and physiology.
Who do you think will be more likely to get Graves' disease, men or women?
Maybe men. I don't know. Aren't they prone to more disease?
Graves' disease affects men and women, but women are 10 times more likely to get this disorder. At what age do you think a person would acquire Graves' disease?
Maybe in their 50s or 60s. Wouldn't that be an elderly person's disease?
Actually, Graves' disease can occur to anyone at any time, but it's more often going to start in the 20s or 30s.
Oh, well, I never knew that.
Well, we've gotten a glimpse of what people think and know about Graves' disease. Now back to you, Eric and Shalik.
Thank you, Rebecca. We will now have a commercial break. Stay tuned.
Do you suffer from thick red skin around your shins or top of feet, goiter or bulging eyes? Then it's possible you could have Graves' disease. If you believe you are suffering from Graves' disease, consult your doctor and ask about beta blockers. Beta blockers can reduce symptoms of hyperthyroidism, including tremors, rapid heartbeat, and nervousness. This medication does not stop the production of hormone, but it helps with lessening the symptoms. Call 1-800-244-3937 if you are interested in this drug.
Thanks to viewers like you.
Do you know about hypothyroidism? Hypothyroidism is when the thyroid gland stops producing enough hormones. Symptoms may include shakiness, tremors, or even insomnia, which may cause severe problems, but there is ways to treat this. Those of which include levothyroxine, a synthetic T4, which replaces your missing thyroid hormones, and levothyroxine, which is synthetic T3, which also replaces your missing thyroid hormones. Be sure to consult your doctor before taking these medicines.
Welcome back to Anatomy News Network. We would like to continue our report on Graves' disease.
If you're affected by Graves' disease, it could have a tremendous impact on your everyday life. A person with Graves' ophthalmopathy could be suffering from bulging, irritated eyes, limited eye movement, or excess tearing. A person with dermopathy could be suffering from red and thick skin on top of shins or feet.
With these symptoms, everyday life could seem hard or stressful, but there are medications to help with Graves' disease. One could try beta blockers or anti-thyroid medication such as methimazole or propylthiouracil. 10 milligrams of methimazole would be $20 and 10 milligrams of propylthiouracil would be $15.
By taking these medications, symptoms from hyperthyroidism could be lessened. Consult with the doctor before getting any treatment.
This has been Eric Wynn and Shalik Fleming.
Thanks for tuning into the Anatomy News Network.
Have a great day.